radio fix or the operation.
Just so you guys know, I have unmuted Chambers and we are live on YouTube.
Well, you're early.
Quit screwing around.
Happy birthday.
Is it your birthday?
Everybody, turn on live.
We're online, Mark. Which meeting's first? Coming up. JP. Thank you. I should know that. What's the reason I don't?
Let's drive after 9 now.
No, I'm not that old. Okay, since Amanda unmuted us. How are we doing on attendance here?
Is Trisha there?
Have enough for a forum.
Yep.
Okay, it looks like it's pretty close to 5:30. Call the meeting to order, roll call. Is done. Minutes to approve.
Move them, Petrus.
Second, Mike, go.
Thank you. All in favor? Any opposed? Carried. We have no appointments for the evening. The presentation with Mr. Tom Odessa from the SPCA is not going to happen tonight. Mr. Odessa is sick, so that meeting will not happen. Hi, Trish.
Hi.
So with that, we'll get right in to department updates. And Ms. Spingler, you are up first from 911.
Good evening. Just a couple of things to touch on in regards to training class. They have all made their way through the classroom portion of the training and are all on the floor. So this next process is about 12 weeks, give or take, depending on how well they do in the call taking phase. And then at that point, they're assessed and we decide whether or not to move them onto dispatch or, to give them some additional training to help them make it through. In regards to the communication system, still seeing the same thing on here. I'm still waiting for a quote from Motorola. I did reach out to, kind of gauge a time frame. They are pretty backed up, but one of our issues is that adding sites will cause additional equipment needed for the microwave network because some of the equipment that's in our microwave network today is no longer in service. So it's repairable at this point, but it's not being made any longer. So that means some of the network, a portion of the network at each site is going to have to be replaced. So it's going to cause an increase in cost. So once I get more information and I get some finalized numbers, I'll be sure to get them to everybody. I do have 3 resolutions this month.
Just go right ahead and take them one at a time, Denise.
JP1 is to find an agreement with Red Creek Schools. They are going to put just very minimal equipment on our Sterling Tower to help with their communications from the buses. Minimal cost annually, I think it's around $3,000 annually that they'll pay us for that.
Move it, Petrus.
All right, I have a motion. I need a second.
I'll second. Daily.
Okay, I have a motion and a second on JP1. Any discussion?
Just, Mr. Chair.
Yes, sir.
So it's neutral. They're gonna give the 3,000 and then the 3,000 will pay for what we need. So
We
there's
need to
no,
our maintenance, yeah.
okay, thank you.
Any other discussion?
I did ask what made this different than the one that got pulled because of the shared service plan. And I guess it's the language in here that says the contract will start January 1st of 20.
It will. In fact,
That
this
is-
one and the Yates one, both are, I think we're gonna use both of them for shared services.
Okay,
They're both gonna start.
and that contract date is really what's needed to have a shared service.
That's
plan.
correct. That has to start January 1st to be qualified for the shared services projects.
Okay,
We are going to let both Yates is JP3, both counties, or both entities put equipment on because with winter coming, obviously that would delay their project significantly. So we're gonna let them do the installs this fall and then the contract will actually start January 1st.
okay.
Yeah.
Any other discussion on JP1? Hearing none, all in favor? Aye.
Aye.
Any opposed? Carried. JP2.
JP2, I'm trying to be creative here. So this is to sign an MOU between the county and CSEA. The goal of this is to promote weekend work. We are seeing a significant amount of sticks in the center. On average, we see about 60 hours of overtime being posted on weekends. Why? Because they only get one every 6 weekends off. People want to have their weekends off. So to get them off, they have to take time off or call in sick. So based on my predictions, it's not going to be a huge financial impact at all to our budget. We are over 200,000 under budget right now, and that's really a result of staffing. We know we've had a lot of vacancies all year, so this isn't going to impact our budget. But what this will do is incentivize working on weekends. It will give the employees who choose to work an additional half-time pay. So if they work overtime on a weekend, they get their time and a half. This gives them an additional half-time pay if they're choosing to work it. It doesn't mean that regularly scheduled people on weekends get that pay. It's only people who choose to work to help out with some of that overtime that we're getting hit with. The last few weekends we've seen, people they're calling in because they want a weekend off. So we've seen a lot of mandatory overtime, and I don't like people sitting there for 16 hours when that's not by choice. If they know it ahead of time, they're planning their meals, they're planning their sleep. But when you're at the last minute getting stuck for 8 hours, it's a long shift.
Is there
You can find ways, and I'll be honest, I stole this idea from some of our surrounding counties who've been doing it. Onondaga actually does double and a half for any hours on weekends, and Cortland also does the same. But we really need to become more competitive with our surrounding counties because everybody's hurting for staff. We have been fortunate right now, and I really don't want to lose people. And this is a kind of a small way to promote our staff.
Okay, I'd like to get a motion we'll move it to the discussion phase. So can I get a motion on JP2?
I'll move it.
Okay, I got a motion and a second discussion. Denise, just real quick on my end of it, is there a sunset date on this?
There is, it'll be March 31st. And that sunset date comes from the anticipation of the new trainees being on the floor, hopefully helping our staffing levels.
It says April 30th, is it? In the resolution?
Peter might have changed it.
I don't have.
We may change it to March 30th. I anticipate them being on the floor hopefully by April 1st.
Because that was what I was gonna ask. This is gonna sunset when
It's gonna sunset.
when you're at full staff
Yes.
and you don't have to worry about burdening
Yes.
just a few people.
And in fact, we are kind of looking at how we are doing our training. We just put all of our trainers through a CTO course. So generally what we do is once they get through that call taking, they go through a dispatch process. So that's roughly another 3 months. That would put all of our trainees roughly on the floor somewhere around April 1st. Fire training, maybe May, because that takes a little longer. But what we're kind of learning is maybe it might be a better process if we train them on all disciplines before we release them. So that would speed up the training, but it would delay them being put in a schedule. We would probably see them being put in a schedule towards the end of 2023 if we do it that way. But what that does is it gives us a better idea at the end of 2023 if all of these people are going to be successful. Because one of the hurdles that we face is having somebody trained for 2 years and then moving them to fire training, and they can't do it. So then you're letting them go after they've been there for 2 years, 2-3 years. So we're just in very beginning stages of looking at that. But yes, this will sunset. It's going to sunset based on the fact of those new people hopefully hitting the schedule and helping some of our staffing issues.
Any other discussions for JP2? Kevin?
Where does it tell us in here that it sunsets?
That's
Not
the
the
date.
actual resolution itself.
Last paragraph.
Oh, okay, I see April 30th. I thought we said.
Yeah, and then the MOU has a sunset in it as well. There's a draft MOU.
This alludes to the MOU being sunsetted at April 30th.
That's what, that does say that.
Just more of a typo thing here. It's in the resolution itself. It says MOA. Should that be MOU?
It's memorandum of agreement, memorandum of understanding. They're kind of
Same thing.
the same thing.
Just checking to make sure we're correct here. Okay, any other discussion on JP2? Seeing none, all in favor?
Aye.
Aye. Any opposed? Hearing none, carried. JP3, go ahead.
AP3 is to sign an agreement with Yates County to utilize the Ovid site. We talked a little bit about this last month. This will be part of the shared services. We will let them put the equipment on prior to January 1st. Like I said, because of weather, that just really would slow up their processes. But the contract will not start till January 1st, so we can include it in the shared services plan.
Move it.
I have a motion to use second on with Elaine. Any discussion on JP3? Hearing none, all in favor? Aye. Any opposed? Carried. Thank you. Anybody have anything else for Denise?
Thank you.
Hey, next up on the list, Mr. Lloyd Hoskins is not here. He did speak to me today. He said you'll have his report. Anybody has any questions? Okay. Next up is Dr. Adam Duckett, our coroner.
Well, I will actually give a quick little update then, because I'm here more so wearing my hat with the sheriff and the medical. I think the only thing interesting to kind of report, year to date, we've only had 4 overdose deaths, which is obviously still 4 too many. It's actually interesting because this is the first time in years that it's actually been that low, knock on wood. The breakdown of that really is, one was just purely cocaine related. 2 of them were fentanyl, heroin related, and 1 was fentanyl and synthetic MDMA. So that's the Molly. So it's a big departure from what we've been seeing the past couple of years prior. As you know, fentanyl is the common denominator with practically all of the overdose deaths for the most part. But the bigger ones were mixing the past couple of years, mixing fentanyl with the MDMA and cocaine and crack and things like all the stimulant type drugs. From working down the jail and dealing, with my practices with East Hill and such, I do see that there's a lot of patients that battle addiction that are trying to be more cognizant of what's in their drugs. Molly is still the drug of choice, but I think they're seeking Molly that's more pure, stimulants that are pure. It's certainly what we see more so in the jail than anything else. It's Molly, 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 heroin, Molly, 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 heroin. Usually when I get the calls from my nursing staff, but I'm very happy to see that number has finally begun to come down. Suicides are still up. They're not as much as they were last year. I actually have to look at that. Let me see it really quick. I have that report that I just had her do. Let's see here. We have 1, 2, 3, 4. 5. Then a homicide. So 5 deaths, 4 suicides, and 1 homicide this year. So that's actually down suicide wise from last year too. Obviously, the pandemic and such, really, when people were not getting access to their mental health care and things along those lines too, this impacts. Now that we're kind of getting more open to business, people are in to get to see their counselors or therapists and their doctors, and people getting more of a routine. It's certainly, I'm sure, helping to a degree. But anyway, that's really the only update that I have. It's a good update, but I will say that it also concerns me because being in this for the past 8 years, sometimes this can potentially sign a sense of change. Maybe there's another drug that might be coming out. They're always trying to get things that you can't test for, because they know that you're doing urine toxicologies and things. So they're always trying to find that new synthetic variant that you can't test for. So this is something we'll stay aware of.
Thank you, sir. We have questions. Start with Chairman.
Thank you, Chairman. You got all your assistant coroners? Are you filled for staff?
Yeah, we're filled. The one thing I didn't realize, and I was actually dealing with a legal, because last year I asked them my budget to, because they make $6,200 a year and they're on call 12 shifts for 12 hours and have to get up in the middle of the night, snow and everything else, driving their own equipment. So I asked for a $2,000 raise when legislator Vitale kind of give it a shot. So we put it in the budget. That budget was approved for this year. And I just was waiting stupidly, wondering if that would come on, but apparently I have to do, and this is my fault, even though the money was budgeted, I have to then put a resolution to accept it. So I was like, this doesn't make any sense, but I have, I went there a couple weeks ago and he was gonna put something, I'm hoping to have something for next month to actually ask, because I want to get them back paid for what they promised that they would have. Because I mean, now they'll be making $8,200 a year, which I think is good. But they, they do a lot.
How many do you have, Doc?
I have four of them. So I mean, it was really just asking for $8,000 more is what I asked for that year.
Thank
You
you.
fought the fight, but you didn't.
Well, I didn't
Yeah,
finish the job.
yeah.
So I mean, everything will be square. They'll get there with it, but I have one of the best teams I've had. I've always had a good team, but this is a very exceptional team. My most recent was Tom McNabb. If you guys don't know Tom, he works with Whitechapel. His sister is Eileen. He's been my last addition. He's been great. So.
Thank you.
Doctor, it was brought to my attention by the legal counsel that if you could get your folks to draft that resolution for the inquiries.
Yeah.
And have it prepared for our Ways and Means. We might be able to get it through and not have to wait.
Oh, okay. Yeah, no, I can certainly say and just say, whereas we were approved the 2000, but all the fancy wording there.
It's a week from today, Doc.
That comes out of your salary, right, Doctor?
That's fine. To be perfectly honest, if that's the way I would do it, I mean, I don't,
The sheriff might be willing to help you with your resolution. So.
Oh, thank you.
Yeah.
Thank you.
Mr. Muldrow.
Oh, hey, Brian.
It's Mulder, not Dennis. So we just.
Yeah.
I know.
Adam, you said there was 4 overdose in
Yes,
this
sir.
town.
Deaths.
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 Yes.
Decrease. What do you contribute that to?
I think it's multifactorial. The number one reason, and this isn't anything in our control per se, but people, as we saw with the evolution where heroin was on the rise, heroin, fentanyl, people are now afraid. So when people began to get afraid of the heroin because it was laced with fentanyl, they went to Molly. And then we saw, oh, it's okay. But then it's like a filler product, it's cheap, whatever else, people put in there to give it addictive properties, whatever they want to do. So then all these synthetics that became popular began to have fentanyl in it too. And now people are being more cautious. They're beginning to see the signs that, oh, that crack has a little bit of a brown tinge to it, and it's maybe not good for me. There are some testing and things. I think I think the fear is the number one. Number two, I believe it's because people do have access to their care again. And I think that's a big component of it. Number three, I would say that one of the good things that the healing community study did was doing a lot of the pop-up events for the Narcan, which I'm sure played a role in it too. But a lot of times when we see people die in overdose, like we had people in the same neighborhood. I mean, within 6 weeks, it was this year, it was just a couple, like probably a few weeks ago, we've had 3 overdose, 1 died, another one had to be hospitalized, and then we just went there again a couple of weeks ago, and another person that was across the street, they originally overdosed, actually overdosed and died this time, but they were using crack and different things. So that one's still happening, so that would probably be a 5th. But our biggest issue is getting out into these remote areas that a lot of people, they don't go to doctors. I mean, we have to still get a lot of engagement. I think we do too much right now. I mean, we have to focus on treating people and not the addiction. Like we need to be kind of have a multiple ways of approaching these people. But no, I mean, like I said, the number one is people are afraid. Number 2, access to care. And number 3 is probably some of the Narcan trainings.
It's awesome.
Okay, got a few more questions.
Yeah. Heidi, yes.
Doc, I wondered, you mentioned, and it's referenced a little bit in one of those Healing Communities report that came out just late last week about rural issues.
Yes.
So have you noticed that these, the overdoses that lead to death, have they been more rural oriented? It's a cluster of addresses.
It's a mixture, and I would have to take a look at the things, but it's a good mixture between the two. I mean, I think that I'm going to be giving a presentation in Saratoga for the state, for the Chicane, which is a kind of community health center organization throughout the state. It's like every healthcare organization, Article 28. They asked me to speak about this because, you know, you have the academic world and you have the boots on the ground. The boots on the ground are seeing, oh, geez, look at all this stuff coming in. And then you have the academics, hang on, let's study this, let's understand this. So as things are happening, it takes time to study, but things evolve. So what we've got into when we did the healing communities is that we got big into Suboxone. And Suboxone is a great drug, but it does nothing for crack, does nothing for Molly, it does nothing for the stimulants. For opioid, pure opioid addiction, it's phenomenal. It can be very effective. I have people on it, sublocated injectable, but people that abuse multiple drugs, like I have a family member that does whippets. I mean, we had people in the jail, they were all getting high and drunk. We don't know why. They're drinking the hand sanitizer that smells like the discus and urinals. We had inmates drinking that and getting drunk. So when you actually battle addiction, you abuse, most people abuse polypharmacy. But so kind of getting back to what I was saying is that, you know, our focuses are delayed because of how academics and the boots on the ground, these two groups, they always kind of fight. It's like, we're not seeing this anymore. This is what we're seeing. Well, we gotta study, I think. But now with the recent grant that I was just talking to right now about the $1 million, that is actually giving us the tools to battle, like the peers, filling in, you know, the gaps in care and things. It's not about doing a study and just give us this data, give us this data. We're actually going to be able to fortify and get people in, because honestly, in my years as being a physician, the most effective thing I've seen is Nick's Ride. And that's better than me, East Hill, that's better than Cayuga County Mountain, better than anyone. It's not taking away what we're doing. It's just that when I say something to somebody, I'm looking at it as an authority figure. But when somebody that's actually been in jail, been in prison, has overdosed and nearly died, saying you got to get help, that's powerful, right? That's powerful. And that's why that type of stuff is more effective. Joel Campanola one time, he brought a guy, and I remember this story, he brought a guy down to rehab. And then after his 30 days, he went down there and picked him up. And the guy was in tears. He couldn't believe that you're here to pick me up. And it makes me emotional even thinking about that. But these people have nothing. They've lost everything at times. That's why getting peers is so important. But sorry, I don't want.
No, you're fine, sir.
But you need access to care that the peer can get person to.
Yes, and the thing is, and that's the thing, the peers, but just having somebody that cares about you, that gives somebody a purpose, giving a person a purpose. You know, I had a guy today, he got invited to something for his job. Biggest thing, he says, I know it's somebody like you, that's a small thing, but to me, a year ago, I mean, they would never even invited me. It's those small things. So sorry.
Oh, you're fine, sir. Any other questions for the doctor? Doctor, thank you for coming in. I appreciate your time here, sir. Thank you. Ms. Antonacci, you are up next, our district attorney.
Good evening, everyone. I have just a bit of good news to share. I received word that we are the gold star county when it comes to the 7th Judicial District for criminal cases. So we are doing very well. It means that we have the lowest percentage over standards and goals. So we are 11% over standards and goals. The next closest county is 19%.
What does that mean?
Meaning cases that are past 6-month mark. So we, the 7th Judicial District, from arrest to trial, we average, it's supposed to be around 6 months. So we are very close to that. In fact, we right now are back to our pre-COVID speedy trial time. So we were about 6 months average to resolve a case from arrest to trial, which is amazing.
Yes.
So we've completely cleared our COVID backlog, which has been a long time coming, but it's clear, which is great. We had our new deputy chief start on October 3rd. We're fully staffed, up and running. It's amazing. I feel like we haven't been fully staffed in a very long time. So it's a great feeling. I want to recognize 2 of our prosecutors. They did a felony criminal contempt trial on September 28th, got a guilty verdict, very professional. So I want to recognize their efforts. They did a great job there. Was reading Lloyd's report. I just wanted to point something out that I thought was interesting. If you look at the first bullet point, it looks like in the month of September, 48% of defendants were held at cap arraignments. That's a high percentage given the bail reform laws. And that correlates with the 48% that were brought in arrest warrants and bench warrants. So you see that law enforcement is actively going out and picking up people on arrest and bench warrants. That's a very high percentage, and they're able to be held because they are willful and persistent failures to appear. They're not showing up for court. So I just wanted to bring that to everybody's attention. That's a pretty high percentage here. So I don't have any resolutions. If there are any questions.
Any questions for the district attorney? Trish, go right ahead.
I'm glad you mentioned that on Lloyd's report because I had it highlighted and I was wondering about that in terms of so of the 48% brought in on bench warrants, how many were released of their own recognizance again, or were they all brought in on bench warrants and held without bail?
So
how many chances do they get?
So to be designated as willful and persistent offender for failure to appear, it's got to be at least 2 to 3 times you failed to appear in court. And then the court will write, and city courts does this quite regularly. They'll write willful and persistent, and then the judge will know that they need to hold them. And then our office will have to hold a hearing in the city court. And I'm assuming most of them,
Lydia.
some are in the city court and then some are also in the town and villages.
Lydia, you're up next, please.
Hi, thank you very much. Brittany, congratulations on the great track record that you're talking to us about. It's also a great way to attract and retain employees. So congratulations and thank you.
Thank you.
Anyone else? Mr. Chairman.
Thank you, Mr. Chairman. The October 25th, can you explain that to the rest of the group a little bit?
Sure. The SPCA is going to be having an animal cruelty and domestic violence seminar at the Hilton Garden. It's open to the general public. It is free. It's a great cause. There are going to be many great speakers. So if anyone is available, I obviously encourage you to attend. It'll be a great seminar.
What time does that start?
Well, I believe it starts at 9, but don't quote me on that.
I think that's what it is also, 9.
Thank you.
Thank you.
Go ahead.
So I just wanted to say, great job again, kind of dovetail on what you said. And also, I couldn't resist the opportunity to bash the current legislation. I just think everybody needs to understand that, and correct me if I'm wrong, it doesn't matter if they're a danger to the community, danger to themselves, danger to others. It only matters if they're a flight risk. So you cannot, and your ADAs cannot say, hey, this person has a demonstrated history of, gutting people and using their shin bone as a pencil box. That doesn't matter. So you're getting, when the presumption is upon release, they're still getting these retained based on the, probably the effectiveness of your ADAs and their past history of absconding, correct?
Correct. We have several factors in the criminal procedure law that we have to follow when it comes to whether or not bail can be set. Dangerous is not a factor that courts can consider currently. I just had a case, it's very tough on some drug cases. One, it prevents us from getting help for people who need help on drug cases. But also, I had a case where a guy who got arrested on a B felony drug case, he just got arrested in Monroe County for having 2 loaded handguns within 3 weeks. So thankfully, I can petition the court. I petitioned the court in our county to have his bail revoked on my underlying case. But there are several factors and rules we have to follow.
Anyone else for this attorney? Brittany, thank you to you and your staff.
Thank you, Brett.
Well done. Next up would be Riley Shirtliff. Riley is not here. He's still en route from Alaska. I have no updates from the UMO office. So with that, we will pass along. Riley's start date is 17th of this month. And I'm sure as soon as that day arrives, and we will probably hear from him next month. Next up would be J.D. West-Belair. He is not here. I believe there may be somebody on the internet.
John Madden's on there, I think.
Yes.
Hi, it's John Madden. How are you?
Hey, John.
Go ahead, sir.
So JD provided department updates and policies. I certainly try to answer any questions. We also are looking for permission to fill a part-time clerk typist ignition interlock service monitor. Presently, go ahead. I'm sorry.
I was going to say that's your JP4 for tonight.
Correct.
If you'd like to take care of that right now, we'll go ahead. And
I'll move it for discussion.
Okay, we have a motion. I need a second.
Nightingale, second.
I have a second. Any discussions? Anybody have any questions or concerns? Go ahead.
So it's John, it's Chris Beatrice. How are you?
Hi, Chris.
So this is all budgeted for and everything, this isn't a crate and fill or anything like that, correct?
It isn't budget, it's gonna have to be budgeted next year. It'll have to be added to the budget. But for this year, I believe there's money, if it does get filled this year, there's money from DWI fund that would fund it through at least the end of the year if it does get filled this year. JD's indicated it's approximately $18,200 for next year.
Wayne, go right ahead, because I think you're gonna say what I'm thinking.
Yeah, I had asked Jay a set of questions about this, and they're taking $16,000 from another budget account, Stop DWI, and they're moving it, if this passes, into the probation budget. And the part-time clerk that's in the probation budget is unfunded at this point. So it exists, the position exists, but there's no funding to it.
Correct.
So they want to take the $16,000 from the Stop DWI, put it into this year's budget, although he admits he's not going to use the whole 16,000 because there's only 3 months left in the year.
Right.
But next year, if this passes, then Jay will budget for, he told me, a 17.5-hour new part-time clerk to assume the role, the duties that Tracy Colson was doing, monitoring this interlock. So that's kind of what, is that your understanding too, Jay? John?
It's approximately 18,200 he indicated to me in 2023.
If you budget a full 17.5-hour part-time position, that's kind of.
Correct.
Go ahead, Chris.
Is this the position that was normally handled by a subcontract agency and is now back?
It initially was Cayuga Counseling, and then it went to Tracy Colson, and now they're presently going to transfer it over to us.
It was a Cayuga Counseling for several years.
And I had asked Chris, there's like 26 people that are being monitored outside of the probation.
So.
Correct, yes. As a second quarter 2022, there were 26 cases.
I guess I think it's certainly more cost prohibitive to pay someone on the county than to subcontract that out. Is that fair? John, I know this is not really your wheelhouse here, but I guess I would say that to my colleagues. It's more cost beneficial to have it handled through a subcontract agency than it is to pay someone through the county at a higher salary with legacy costs.
Well, it's a part-time position, so I don't know that there would be benefits involved with it. That I don't know what the cost, the savings is. It's not a position we wanted, but it was given to us. So
exactly, I know, I know, John, I know.
Mr. Chairman.
Yeah, from what I remember, Chris, Lynn and I met with Boyd at the time, and we found out that the Cayuga Counseling did not want to handle it anymore.
I remember the story.
Yeah, because of manpower. So that's why it was transferred over.
And just for clarification, John, when I asked Jay, this is certainly some additional work that the probation department is going to assume. It's not part of your core services.
Correct, yes.
Mr. Basile, you have a question?
I'm just trying to understand what Legislator Petrus was saying about, so are you thinking that we should be looking to outsource it than to do it in-house? This is where we have the discussion.
Right. I personally think it's more beneficial to be done through a subcontract agency. I remember the situation, and I'm trying to dance on the head of a pin right now. But so I do remember the situation, and I do know that there was significant factors involved in the decision to move it to the county, but I feel as though that was a misguided choice.
Okay.
I mean, the work still has to get done. Tracy needs to get out of doing the
If it
responsibility.
wasn't broke, we wouldn't have to fix it.
Well, but at least till the end of the year. So
Yeah, I understand. Yeah.
does it make sense to investigate your point, that go ahead and transfer the 16,000.
But then the position is
Yes,
created, right?
That is true. Yep.
And then now we got a budget,
No.
next year's budget is impacted by that. I would defer to the
Yeah,
chairman.
it's in the budget for next year.
Trish?
Just a question in terms of outsourcing, is there more than one entity in the community we could partner?
I'm not going
with?
there.
I just wonder, RFP done initially to select our partner on this, or could there be, or should there be?
Very small dollar amount.
Yeah.
It's a cost we're gonna pay in perpetuity though. Once it becomes a county position,
And I think it'll be
and then it'll get rolled over to full-time.
subsequently, yes.
That's what's gonna happen.
You're afraid of the legacy charge that comes with it though.
Well,
Yeah, absolutely. It's, we're here for discussion.
I think that it was functioning fine the way it was. Like all things government, it had to be fixed.
Don't make them full-time.
Now we're refixing the fix. I'm just one opinion on that.
Sure.
Mr. Chairman.
Jen, I'm gonna ask you a question. This position has already been filled, hasn't it?
No.
We don't, no, it hasn't been filled yet. It hasn't been approved. We have some ideas of who may be willing to take it, but
All right,
it hasn't been officially approved yet.
okay, thanks. It's in the budget, but it hasn't been approved.
And we should
You're in 23 budget.
Right.
move the table.
It's not in this.
Yeah, make a motion.
I can't.
You haven't seen the budget. You're not.
I can just, I whisper to you. That's what I'm whispering to you.
Heidi, you have a comment?
Yeah, Jay's not here to answer to this, so John's probably not going to be able to, but had they, once things got to this point and, bringing the resolution forward, had people thought about an RFP?
I can't answer that.
The honest answer is probably
Jay's
no.
not here to-
Well, I know that the idea was that it would be better suited, and please someone if they have better information, it would be better suited managed here. And then when it was, and again, you're on the board, so
Yeah, I think that question probably should be asked to Lloyd.
Oh.
I'm sure Lloyd would have an answer for us.
and I can't, Heidi, I can't go.
Sure, I
Sorry.
understand. Well, I'd like to make a motion to table.
That's what I couldn't do it.
All right, we have a motion on the floor to table JP4. I need a second.
Second.
Any discussion on the table?
It's a good idea.
Hearing none, all in favor of the table? But I do have one thing, table to when?
Table to next meeting.
Next
JPS
JPS.
committee meeting.
And Jay will be here, right?
I would hope so.
Yeah.
Unfortunately, John was here the last time it got tabled and Jay was, so.
Sorry.
Sorry for you, John.
Sorry, John.
Yeah, sorry, John.
It's okay.
Let's keep, all right, so we have a motion to table JP4 until the next JPS committee meeting, which will be in November. All in favor?
All right.
Any opposed? Carried. So JP4 will be tabled to next month's JPS committee. And just my own curiosity, our legal folks here good with that procedure?
Yes.
Very good.
Can I just make a
Yes, sir.
suggestion that maybe you and I sit down with Lloyd and Jay?
Absolutely.
We'll have an answer.
Make that, I'll try to make that happen.
Thank you.
Thank you.
Thank you, sir. Okay, next up,
Could I ask one?
Yes, ma'am.
Before John goes, could you talk about the $134,000 grant that you got that came in as unanticipated revenues? And it's certainly not part of Raise the Age, but it's more part of the free trial services like the Alternatives to Incarceration. Is that true?
I can't really answer that. I saw the note that JD had put in there. I don't have a lot of information regarding that. I think that would be something that JD would be better able to answer than myself.
I mean, that seemed like good news that there was $134,000 that came in. Okay, thanks. You can talk about that next month too.
okay, any other questions? Oh, wait a minute.
Yeah, I was wondering about the criminal justice advisory boards. If there was just a brief explanation about what those are. Are they regional boards? How do we engage them?
The district attorney used to have.
Jay
John,
took it over.
oh, Jay took it over from John, okay.
Are you talking about the Alternative to Incarceration Board or the Judicial Advisory Board?
It's listed as the Criminal Justice
Advisory
Advisory Board, that there was a statewide webinar
Right.
focusing on these, different from the ATI board.
I believe those boards will be county oriented or originate in the county, and they're boards to try to make sure that services are better as far as like, people coming out of jail or raise the age or different, drugs and alcohol issues to help make, better policies, which would include, I think, stakeholders within the county would get that information together and try to come up with better policies for the county for the goals of, again, making better decisions for, keeping people out of jail, raise the age, drugs and alcohol issues, and whatever issue that needs to be addressed. From what I read on the slides that JD had sent.
Okay, so we don't have an active one here.
No, not yet. I think JD was going to send it out to the Alternatives to Incarceration Board, have them look at it and figure out how we can best come up with that.
All right, thank you.
Any other questions for John from probation? Okay, Sheriff Shank, you are up, sir.
Good evening. I did submit my report. I'm happy to answer any questions relative to what's documented there. And I do have one other item I wanted to bring up if there's no questions relative to the report.
Good answer.
Okay, I wanted to just bring to your attention some difficulties and struggles that we're having with our medical division in the jail, just due to the simple fact that we're seeing a lot of very sick individuals that are coming to the jail on a regular basis, a lot of issues related to addiction and mental health struggles that people have. And with standing up our MAT, the medication assisted treatment program, and all of this kind of coming to a head, it's becoming very difficult to manage all of these cases and provide the standard of care that we're expected to provide. So I asked Dr. Duckett to come along with me tonight just to comment on that, but he's brought to my attention, a few things over the last year as far as the difficulty we're having maintaining records, maintaining the quality of care for the inmate population that we're expected to maintain. And I'm concerned with the liability that we have in that area. And I can't really give you data or stats relative to what we're seeing as far as, the types of cases that we're dealing, the difficulty. I'm sure Dr. Duckett can speak to that a little bit better than I can. But over the last couple of years, we've just really seen a huge increase in the difficult cases that we're managing. And I don't know if that's, a product of a very sick, struggling community. But we've really got to start to think moving forward how we're going to manage the challenges that we have there, how we're going to manage our records, how we're going to manage quality control, policy oversight, and management of day-to-day individual cases. And my concern is I just don't ever want to be in a situation where we've set ourselves up for a lot of liability because we're not taking care of those things. So, there was a time 10 years ago, even 5 years ago, where, we weren't seeing the level of illness and addiction and mental health issues that we're seeing today. So a lot's changed. We're still doing it with the same number of staff, except for we're going to add the LPN position with the MAT program. But, maybe the doctor, if it's okay, can speak to a little bit about what he's seeing in the jail and some of his concerns. But he's brought these things to my attention. It's important for all of you to understand, the potential liability we could face if we're not trying to address some of these issues. And unfortunately, it's going to take some creative, work to try to figure out how we're going to address some of these things, whether it be consulting with outside entities to help us meet some of this need, or adding staff, which I don't really want to do. But I just, we're going to have some difficult conversations in the future as to how to address some of this. Do you want to speak to that? Is it okay?
Yes.
Mr. Strong?
Yeah. Just briefly, few years ago, I was actually sitting at AT Wally's with Captain Mack, and they were in the process of potentially looking for another fighter. So Sheriff Gould was still Sheriff Gould there, and I said, sure, I'll do this. And then when I got down there, it's just like, oh my goodness, you know, working in the outpatient realm, you know, working with East Hill and a lot of people that are very big quality sticklers. Here we are, everything is paper, everything is in file cabinets. This is like medicine from 15 years ago. I don't know. I called the state and I talked to them. What do you expect out of a jail division? We're starting from the child up or from the ground up. They said, well, it's like any other primary care office. So a lot of things I think that we haven't, there's a lot of things that we probably should have evolved to do, but we didn't, but now we're at a head with the MAT that's kind of programs that were thrown into our lap. As you know, we have to provide Suboxone, methadone, and Vivitrol all in the jails. And, you know, and that's fine. I don't really have an issue with that per se at all. But the biggest issue that I have is the fact that it's going to just exponentially, it makes our costs and our needs skyrocket. Because first off, to effectively do a program like this, you need to have electronic health records so you can transfer them back and forth. This is also giving us, no offense to the lawyers of the world, another space for us to be liable and have issues being sued. If you've seen in recent years, and one of the things that I've worked with the Chief Elser and Captain Mack on, the vast majority of the cases against jails are medical. Why? Because they're easy targets. They know that most jails are very weak. They have like a doctor that comes once every couple of weeks. They might have one LPN that's there, you know, Mondays and Fridays. So they go after the area where they could potentially get money. So now we're just opening up the door for a lot of that. But besides the liabilities and stuff, the quality of care is very important. Fortunately for us, Kathleen Cuddy and her team have MedEnt is approved for the health department. MedEnt is what the vast majority of all providers, the hospital, doctor's offices, East Hill, we all use MedEnt to communicate. The counties already has that. That's been, so piggybacking on what they're doing, and I've already spoke to Nancy Purdy, we talked to Kathleen about it. They were kind of doing their rollout, and then we would kind of piggyback on that. That will answer a lot of it. The other component is having people that will actually help kind of, you know, do oversight. Like, I mean, people in the community know Abby Gunger, she's our director of clinical services. She's big into quality, all these other things. Having people like her minds do the case reviews, stay up with the current guidelines and pull charts and different things that are to show that we have checks and balances, because that's where a lot of the legal components, like, let's see your policy. Okay, and well, this is what you actually did. It's not really jiving. We're going to actually do a lawsuit. So right now, you know, while my nurses do the best they can, I mean, the problem is that everything is just on blank pieces of paper. So we got to get that up. We need to develop these systems. So the sheriff is probably, like I said, going to be asking for more money, but this is unavoidable at this point. I mean, if I came to you saying that body bags were $1,000 a piece, now we can't say, well, we're just not using body bags anymore. I mean, that's what, I mean, it is what it is at that point. But we're going to look for very cost-effective solutions, because some of the programs in outsourcing and things, because sheriff and his team's been looking at a lot. Some of these things are like $2 million. We don't need anything like that. But they exploit the vulnerabilities of these counties and communities, and they're making big profits. These are for-profit agencies. So we're looking at alternatives in, you know, in the community and things like that to make this far less. It will be nowhere near that, but it's still gonna be more.
I think I can address the medical record situation with some inmate telephone revenue. So I think that we can do that without coming and looking for something that's going to directly impact our budget. But just moving forward, we're still going to have, you know, some concerns and needs that we're going to need to meet with quality control and the policy management and oversight that we just don't have the full-time medical staff to do. So things are getting more and more complicated, but I just wanted to bring that to you. I wanted to make you aware of it, so it's not a surprise down the road. And again, I want to make sure that, you know, we're doing everything we can to, you know, certainly limit our liability, make sure that we're providing the standard of care that the state commission, you know, mandates that we provide, and not getting ourselves into a difficult situation that's going to cost us a lot more money down the road. So I just wanted to make you aware of that.
Thank you, sir.
I appreciate it.
I got a question, Chris?
Well, before I jump the gun, does anybody have questions for the sheriff regarding that? I just wanted to add that about the ATI. and possibly the sheriff can jump in on this to support my cause here. The ATI board is a requirement and it helps for reimbursement rates.
Classification of inmates or something.
Yeah, the alternatives to incarceration board, that's a mandated board that each county has to have. So we're.
And when we do have that, you're reimbursed at a greater rate due to that.
There is funding that comes along with that, but none of that comes to us. That's more for probation and I'm not sure.
Wasn't there something about classifying the inmate? You had to have a certain, was it the classification of the inmate or something part of that?
Sure, yeah, we have 3 levels of classification for the inmates, and that can potentially impact what we're allowed to do and how we receive certain funding if we don't have those 3 levels. I'm not real versed on the ATI board. I know that's more of something that Jay's much more knowledgeable than I am on, but I do serve on that board with the district attorney.
Okay, got questions all over. Trish, go with you first.
Yeah, I was wondering, for the inmate population that's on MAT, are they discharged back into the community? Or are they discharged to like a rehab facility? Is it a mix? And
Could be both. It depends. So part of the concern that I have is somebody managing that case while they're in the jail, and there's so many things that impact them. You know, their physical health, addiction needs, potentially mental health needs. And there's multiple, organizations and providers within our jail that are touching this inmate in different areas, but we don't have somebody providing the oversight to make sure that we're providing what we should be providing and managing that case in such a way that we're moving it in a positive direction. So that's my concern. But to answer your question, yes, somebody could be discharged to an inpatient rehabilitation facility or an outpatient facility or back out into the public, depending on their particular case and situation. But we just, we lack that piece of actual management and oversight.
right. Well, I figured since Dr. Duckett was here, I'd ask that question too, because it's been something, I just am curious where we're at with those beds in our community. It's kind of getting a little off track, but with the inpatient rehab beds, and I've heard there's gap funding now. That's when somebody's ready to go into rehab, there's sometimes not a bed available, and people are being put into hotels for a couple of nights until there is a bed, and that they're going outside the community for those beds.
It's another great thing that our peers are doing. They're finding those beds for individuals too. The peers are actually not only being a support for that individual, but they're actually finding beds to get that person in a rehabilitation facility, whether they're getting out of jail or they're in our community. So that's more important work.
Heidi, question?
Yeah, 2 questions, Sheriff. How are we doing with nursing staffing? At one point, you were not being able to fill your nursing positions. And then if we move toward integrating med record keeping, electronic keeping with the, have you looked at a time frame for implementation?
I can't answer how long the implementation would take. Maybe the doctor can speak to that.
Two things. First off, I will say that we're having actually pretty good luck. We have quite a few for the LPN positions. A lot of people reach out, very strong folks. The RNs there, that's a different breed. We do have a couple candidates, one of whom is actually very strong, kind of looking to kind of settle back. I mean, as you know, a lot of the RNs right now can get into traveling contracts making $120 an hour. So that's very hard to compete with because, it's just the system, the hospital system really created that mess. But
is there vacant RN jobs? I'm sorry, is there vacant?
Yes, we have a vacant one coming up because we have Nurse Salado who's retiring. So we wish her obviously very well. So we are going to fill her position. And then we have a couple part-time. And that's one issue I will say, and if I may, they're considered part-time positions, but when you tell a nurse, you have a part-time position, you're assuming 24 hours. 24 hours will get them benefits and insurance and stuff like that. This is more per diem. Like these aren't real part-time. So that's harder because people to fill in, they could work per diem at the hospital again, making $120 an hour instead of making what we're doing there. And I'm not asking for us to push that, but I'm saying that if we incentivize those positions to make them part-time ones 24 hours and have it where they had eligibility for insurance and things, you would fill those up in a heartbeat. So
I'm much more confident than I was a year ago
Oh,
in
God.
this situation. I don't think that we're gonna have an issue filling this RN position that we're losing to the retirement. And we have a lot of applications for the LPN position that we created for the MAT program. So I think that we're going to be able to fill those with the salaries we have. So we're in good shape with that. But as far as the rollout and implementation of an electronic medical record,
that's pretty straightforward. I mean, we have help in the community that could help us with that. But I think the biggest thing is, I mean, one of our nurses is already very familiar with it. Our other nurse down there, Haley, who is a brilliant young woman, she'll pick up on it pretty quick. And one of our LPNs already down there, she's worked with Meta. She works for East Hill. She's worked with for a long time. So we'll get it. The end implementation won't be that brutal. Yeah, it's probably over 4 weeks we'll be in a good spot. Yep. It'll be easy to get on, and then 4 weeks will be cooking.
yeah, I hate coming and bringing these challenges to you, but I gotta keep you in the loop. And we're in a different world today than we were a short time ago when it comes to that area of our jail. So,
Chris, you still have a question?
No, I think the peers, is that you got a new reentry program, huh?
we do. Cayuga Counseling's been helping us out with our grant. They've embedded 2 case managers and also a mental health therapist and a caseworker outside the facility. They're doing an awesome job. So I'm hoping in the near future we can have the director of Cayuga Counseling join me for an update just to bring you up to speed with that.
I might be able to pass her a note.
Great, thank you.
Can I move JP 5 and 6 as a bundle? Is that okay, Mr. Chair?
I think we need, if that's all right with the sheriff.
Is that cool?
Fine with me.
Looks like it's just accepting. Unless somebody wants them to, I'll move them as a bundle. Second.
Okay, I have a motion to bundle JP 5 and JP 6. I believe I also have a second from Mr. Video. Any discussion on bundle? Hearing none, all in favor?
Aye.
Aye. Any opposed? Carried. Thank you, sir.
Thank you very much.
Anybody got anything else to be brought before this committee?
I wanted to let everybody know that our next meeting is going to be earlier than normal. It's going to be Wednesday, November 9th. So make sure you put that on your calendars, because a lot of people will think it's going to be later.
Thanks. For JP, government ops can be the same way?
Yes.
Motion to adjourn, government ops in 5 minutes?
Second? So moved. Adjourn.
All in favor, aye.
Oh, is that what we were waiting for? All right. Thank you, everyone.
See you, everyone. See you guys. 6,000. What's that?
He is, that's why.
I got.
Really work until 8 o'clock.
It'll go away.
Just to let everybody know, I have unmuted.
We need to get this, I think we're slipping every day we do.
Hey, John.
How are you?
How you doing? How you both doing?
Went fine.
Can't wait to get out of here, right?
Let's get it going.
If we could get the chairman, we could get out of here.
I don't even know.
I guess cash pizza on my radar, but I'm scrambled.
Hey, how are you? What happened there?
What I want.
They are not.
Jim.
Okay.
Here.
And Patty, Lydia is online, I believe.
Lydia's online.
Yes, I am.
All right, we're ready to go. Call the meeting to order.
Can I sub in for somebody?
You're in the batter's box?
Can I, yeah, can I, coming off the bench. Air General there.
Yeah.
Yeah, I want to come off the bench. Pitch hitting.
Ready? Ready, Hans?
30 words
All
or
right,
less.
motion for the minutes to approve?
Move them.
Got a motion? Can I get a second, please?
Second.
Miguel, second, discussion on the
Good
minutes.
afternoon, sir.
Hearing none, all in favor?
Aye.
Opposed, carried. We have no appointments. I don't think, Katie and Cheryl, well, there's that little phone emblem. I don't know who that is. I can't see that far. I don't think it's either of them. But so the commissioners of the board of elections submitted their data. If there's any questions, let me know. And I'll pass it on to them. You got one?
Just a question I had with these party changes. I was just wondering if there was a snapshot that they could provide us, like.
So what's your specific question? I might be able to answer it because in a past life I worked there.
Or what?
Where they moved to?
Yeah, what kind of changes are happening?
I think that data, and again, I don't want to speak out of turn. It used to be that those changes didn't take effect until after the election.
Okay.
So they'll probably be able to capture that data. I think it's NTS that they used to use, or maybe you're still using, capture that data after the election.
Okay.
Because I knew that's when they used to take effect. The party, it's because of the primary deal, you know what I mean? So you couldn't change, New York is one of the places where you can't change just to vote in the primary. But I can ask those guys. I gotta call Cheryl anyway.
Yeah.
And I'll find out.
I was
See if we
just
can't get that
curious
data.
what was going on out there.
All right, any other questions that you guys want me to pass on? All right, hearing none. Sheila's not on. Amanda was, is that?
I am.
Yeah.
So she has no updates. I sent out the calendars for October, November, and December, just so everybody could be aware of the dates for all the budget meetings. And then there are some resolutions that are under clerk of ledge, but there are some people there to speak to them. Some of them are policy. And then we also have one for Auctions International for 1 year extension.
So Shireen, I saw was on. If you guys, Amanda and Shireen, if you want to bear with me, we'll take, unless someone on the committee wants to do differently. I would entertain, it looks like, so Shireen is here and she can answer any questions. Amanda's here. These look so generally like some housekeeping things, updating policy that Shireen gave her presentation about. So anyways, I would like 2 through 6 as a bundle.
So move.
And a second.
Yeah, second.
So we have a motion and a second. If so, on 2 through 6, any questions regarding that? Shireen and Amanda could answer them.
I have some questions.
Go for it.
Hold on a second. I guess one of the questions I had was what specifically is changing in the fuel safety policy and the excavation and trenching safety policy. I may have missed that.
Shireen, can you answer that? That's a negative Ghost Rider. Mr. Chairman? Oh, there she is.
Hi.
Hi.
I actually cannot speak to the fueling and the fuel handling safety policy or the excavation. I would have to refer to Sheila or Amanda.
Okay, hot potato. Amanda, you're gonna say Sheila.
I'm gonna pass it off. No. Those were submitted by the highway department. But since their policy, they do go under the clerk of legislature. I don't have any update on what was changed in those. I don't know if a county attorney is there, passing the hot potato there, Chris Palermo.
Fred may have gone over this with Brian. He didn't let me know that, but my recommendation would be referred to Public Works just for review and comment and have it come back.
Okay, so how do we go about this then? Because we have a motion and a second. So can we make, what's that?
When's Public Works?
Yesterday.
Yeah, so it'll be next month.
Does it matter that it waits a month?
It's early.
Tricia, how do you feel? Is it concerning enough that you'd like to?
I didn't think, I can't speak to that necessarily without knowing why they picked these policies right now for us to review. But
Okay, how about?
I do think it doesn't feel super time sensitive. So
Would you feel comfortable, and maybe this will speak to your question, would you feel comfortable passing them through to Ways for discussion and then maybe we could get answers either at the full legislature? Does that work for, or Heidi, what was your question?
It wasn't really a question. It was a statement of past practice where we had maybe 2 months ago, some policy changes that came to us that had a focus around health and human services. So they were referred. And it did.
This was, the conversation. I remember that. Yeah.
So, in terms of being consistent with past practice, that's what we did.
So this is, again, I don't have any problem with that whatsoever. I just, because theoretically government operations is the committee of jurisdiction or whatever you want to call it. So if you guys have concerns, we can motion to have them sent there. So first, Mr. Petcher, then Mr. Basile.
I think sometimes we get into too much detail. This is not for us. This is what we hire people for, qualified people. We shouldn't be, examining everything that comes through like this. This is just a waste of time. Sorry.
I'm afraid to go.
After that, you're just gonna let that wash over.
Wash over. It would be good though to just have someone tell us what the changes are. What do we,
So,
but I agree with Hans, but it'd be nice. I also kind of agree with Tricia.
so do you guys want to table it to Ways so we can have more information, or would you like to pass it? Because I don't imagine that's too critical, but I can understand your concern and wanting to have it. So what's the committee's feeling? I know that we have a motion in a second, so I'll need council's advice if we do not pass it for the sake of discussion.
I'd like to hear Brian speak to him.
Do you want to go a whole nother month?
Table it to Public Works.
Well, then, go ahead. Is that a motion that you're making?
I can interject.
Yeah.
You're not really tabling it because that kind of implies that there's going to be a vote. Public Works doesn't vote on that, but they could review and comment. So if you wanted to direct it to that committee for review and comment, they can mark it up, they can make changes, they can send it back to this committee, final passage.
And this one meets after.
That's why.
So it takes a month. And You know, I found the resolution, which was dated 2010, maybe.
Oh, the old resolution.
Yeah, where it said that we were going to bring all of our policies and keep them with the clerk of the legislature.
Okay, yeah, and that's how they come under government
And
ops,
that's how they got
Right.
here. But there has not been any discussion since then about the rules that apply to policies. I think Mr. Petcher makes an excellent point. You know, how do you bring in the right professionals for certain policies? How do you refer to committees for review and comment? That would be something that this committee, I think, would discuss, and
Certainly, but with the specific to this issue.
I think she can move to review and comment to Public Works.
So does that, so then how do I address, because we have a motion for 2 through 6, a motion and a second for 2 through 6. So can I say she makes a motion?
Can't you withdraw the motion?
To review and comment?
I guess you would move to table here, so it comes back next month, and then to forward to Public Works for review and comment.
Public Works is before our.
Right, so, but it'll just be another month. So you're gonna say what he said?
Yep.
And somebody gonna say, I second what she said? So we have a motion and a second.
Motion to move.
Motion by Kerr, second by Nightingale, right? And this is to table to next month with review and comment by Public Works. Am I correct?
Or
2 through 6 all Public Works.
Refer to public.
No. Just
4 and 5.
4 and 5.
4 and 5.
Should
And then we'll
the,
vote.
should the vote to bundle the 2 through 6 just be taken back and
Withdraw
then
the motion.
just start from the beginning?
Sure.
I think
All right.
Mr. Basile.
So who made the motion?
No, I'm just here asking questions. I'm not part of this.
Amanda, who made the motion? Do you know?
It was Heidi or Church, right?
Petcher
Okay.
and Nightingale?
Petcher, and Nightingale, okay.
So
So
draw the motion.
I don't know if he wants to. though.
So it, yeah.
You
Hans,
might not want to, you're right.
Hans, do you wanna, you made the motion for 2 through 6. Do you want to recall that or you? No. That was.
Catch you recall her second. Rescind the second.
Can I ask a question, Chris?
Yeah, I don't know. You can ask it. I don't know if I got the answer.
I think the difference is, unlike the previous policies, they were new to the county. County was creating new policies and some changes were in effect. With this, I think it's more regulated and maybe the attorney could speak to that as far as fuel handling and the excavation, which will be construction. So I think you have much more restrictive adopting these policies with regards, for example, like OSHA restrictions or good practices for handling hazardous material. So I don't think it's going to be anything that we come up with. We're just adopting restrictive policies for.
They seem relatively straightforward.
There's a pretty lengthy website on the 29 Code of Federal Regulations 1926, and it deals specifically with excavation safety. And I noticed that there's a lot of references.
It's like call before you dig kind of stuff, right?
What's that?
Call before you dig.
It's way more than that.
Oh,
yeah, got
very, very, you know.
There's.
All right, how about this? Counselor, can she withdraw her second?
Sure.
So do you want to withdraw your second?
Honestly, given legislator Shea's comments, if here's the conflict. It seems silly to vote on something that I don't understand or know. I don't know the changes. So it's a little bit irresponsible, even though it's, department chairs are doing their work.
Wouldn't you say that we could get the information though? I'm not trying to jam it down your throat, but don't you think we could get the information by the next meeting?
Oh, yeah.
Yeah, so leave it up to you. I don't want to push it. If you want to withdraw your second, that's fine, but I don't want to.
I'm gonna withdraw the second.
All right, so in the absence, so I have a motion Now, in the absence, does anyone else want to do a second? You guys do this to me on purpose. All right, let's go with GO2. Can I have a motion on GO2? We're not going to do anything for the clerk of the legislature tonight, people.
Just extending the contract till the end of the year?
Yeah.
Move it.
So, okay, can I have a second?
Nightingale, second.
Yeah, okay, second by Nightingale. Discussion on GO2. Hearing none, okay.
Just curious, we're just extending it till the end of this year?
Yeah.
Okay,
Says
yeah, 'cause I
22.
thought somebody said a year we were extending it for, so I just wanted to make sure there wasn't
All right.
a typo.
Further discussion on GO2?
Nope.
Hearing none, all in favor?
Aye.
Aye.
Carried. All right, GO3,
The nose, would you please ask for the nose?
a no. The noes, please. Any nays? No? No. No, okay. One, Mr. Petcher was a no.
Okay.
All right. GO3, updating Cayuga County mandatory background investigation policy for staff with access to federal tax information. A motion, please.
Move it.
Second?
Nightingale, second.
Okay, you have a motion and a second. Is there further discussion on updating the mandatory background investigation policy?
I guess I would just say this does seem like something, Bob, that's pretty prescribed and to your example of something that's spelled out. So I'm comfortable with this one.
All right. So,
Mr. Peters, if I might,
yeah,
this primarily applies to the support collection unit.
Yeah.
That's really the state, because we got everybody's tax ID numbers, tax returns, we can pull their refunds.
yeah, with access to federal
Child support auction.
Gotcha.
That's essentially.
Sorry. I did provide, there's only one change. We updated it and I did provide an extra sheet. Did you see that?
Yeah.
Okay, all right. We were asked to come if we had a policy.
okay.
Yes, thank
Do you
you.
have any questions? Do you want to?
I didn't see it there, right?
I can't vote.
Okay.
I jumped in.
Well, you get to vote.
My big head.
Yeah. All right, so further discussion on GO3. Hearing none, all in favor?
Aye.
Opposed?
Aye.
Okay. Carried with one no by Mr. Petcher. So I'll try 4 and 5. Because I think this is the one that's gonna get tabled, but I'll try now. Is there a motion on 4 and 5?
Motion to table.
Do I have a second on the table?
Nightingale, second.
There's a motion and a second on the table to Public Works.
Motion to table to our next meeting and to refer for review.
For review and comment at Public Works. All right, motion and the second on the table. Is there any discussion on the motion and second to table? Hearing none, all in favor. Now, this is to vote to table. All in favor of tabling?
Aye.
Aye.
Opposed?
Aye.
You guys are doing this to me on purpose now. So now, what, it's,
I didn't hear you vote.
I need the opposed.
yeah, there's one opposed, so he gets to vote first.
I do.
Yeah.
To,
Do you want a table or not?
yeah.
All right, yeah, two, so it's carried. All right, so 4 and 5. We're all, except for legislator Petcher, voting not to table. So we tabled 4 and 5, right? So now we'll talk about GO6, adopt a hybrid remote work policy for eligible Cayuga County employees. This one I know has been reviewed. Nightingale for the motion. Do I have a second?
Second.
Second by Mr. Shea. If there's any discussion, Shireen, I think you talked about this, but she already did explain this. So any discussion on GO6?
Can I just ask one question on this? When if this policy passes and goes into effect, what is our plan for kind of reviewing how it's going and whether it's working right?
I'll defer to the committee, which was Shireen and Mr. Chair, were you on that?
No, Tom was on it, Shereen, as far as people being here. And Jen was on it too.
Do you guys have a review period?
Hi, hello, this is Shireen. Hi, everybody. I'm sorry I couldn't give you any information on the other policies for Public Works, but for hybrid remote work, I definitely can. And as for the committee that worked on it, Diane Ferris was on it, Lynn Marinelli, Fred Westfall, and Jen Marshall, and also Sheila Smith. So we had a good group of people that worked on this wholeheartedly. So regarding the remote work policy, the plan for implementation is we did, first of all, review this with the department heads at the last department head meeting, which unfortunately I was unable to be there. However, Diane Ferris and the group did a great job in reviewing it with the department heads. So the department heads, just so you are aware, are fully aware of the whole procedure and process. But we do have a department head meeting scheduled in October for the day after the legislative meeting, and our work group will get together and we can make sure that the department heads are fully comfortable with the policy.
Further questions? Yes, sir.
Shireen, this is Mark.
Hi, Mark.
I guess my question is, or my concern is, there has to be some extenuating circumstances for the individual to request to work from home, correct? Is that a correct assumption? So you can just decide, I don't want to come in, I'll work
For the department head.
It's up to you have to fill out make a formal request to the department head, and the department head will determine whether or not the person and their work can be performed at home.
That is correct.
I think it's one of the biggest things. I can't believe I'm saying this. I said this last time. I think in order to be competitive with other employers, this is one of the benefits. 2 years ago, I would never thought this was something that would be.
So would the department head be considered one of the people that can do?
Yes.
Yes.
And that has to be approved by the chair.
Yes.
I think we kind of, correct me if I'm wrong, Mr. Chairman, but we kind of did this during COVID. And I think it was found that productivity actually increased, which was a good thing. Things still got done. So I guess there was movement to try to make it a very restricted county policy. Working from home can be convenient for many. And as long as the productivity is up and monitored by department heads or whomever.
Okay.
There was a lot of time put in by that committee to make it right, and a lot of people they went out and reached out to. So I think everything pretty much, not pretty much, everything is covered in there.
All right.
And I think it would extend an olive branch to keeping good people.
Yeah. It's a step towards enhancing our workforce. Any further discussion on GO6? You're not on this committee.
I know, but I'd like to ask a question.
Go for
if
it.
I could, Chair. So how is that going to work with the different unions and stuff?
I think our policy.
I didn't hear the
crossed union, right?
I didn't hear the question.
How's it going to work with the different unions and stuff?
I'm sure, Shereen, can you answer that, or John?
I'm just curious, because if one union employee complains about another union employee getting something there, they want approved.
We fully expect that there's going to be some grievances filed about this, but it's within our management rights.
Right.
To create the policy.
Yeah. We
I don't think it's a bad idea.
Yeah.
We have all these different.
Oh, yeah.
Unions. I'm a CDL driver and it's snowing out. I might want to work from home.
Right.
All right. Thank you.
Sure. Shireen, did you want to say something? I thought I heard somebody.
No, I just was going to add to what Jen had stated. I'm fine. Thank you.
All right. So any further discussion on GO6? Hearing none, all in favor?
Aye.
Opposed?
Aye.
Mr. Patcher opposed. All right, so we got through clerk of the legislature, and that'll be the last time I jump around to expedite the process. Thank you, Amanda, Sheila, everyone for bearing with my nonsense.
Thank you.
Mr. Palermo, it says you have no updates, but do you want to add anything?
Well, no, I just showed Mr. Petcher a little bit ago. I mean, it's easier to see on my computer, but we're making a big effort to continue to shift electronically. There's been some changes. Let's call it the sheriff, the chair, as well as the treasurer have both adopted electronic signatures. So now when we get an invoice that comes in for casualty and liability, which is our own self-insurance,
Right.
I'll review them, I'll approve them, and I'll shoot them over to the chair electronically, which then goes to the treasurer electronically, and they're added to accounts payable. And it's a pretty seamless process. You can even do it from your phone. So
Yeah,
kind
nice.
of moving into the current century.
The 20th century at least?
Yeah, at least.
So do you want to do GO1?
GO1 is a fairly straightforward resolution. It's when Lacey Bailey left our office to go to planning, we went for a very extended period of time without having an employee as a confidential secretary. I'm partially to blame for that, not being here. So we contracted with the temp agency to have Lori Coleman, who was fantastic. She did a great job. However, she wasn't an employee, it was through a temp agency. And that all came out of our .4 budget, professional services. Meanwhile, nothing came out of the salary line because Ms. Bailey was no longer, she was coming out of the planning salary line. So we'd like to reimburse our professional services out of the salary for the salary account for the amount we spent.
Outstanding. Can I get a motion in a second for GO1?
Move it.
Motion by Mr. Petcher.
Yeah, second.
Gail, second. Is there any discussion, further questions for? Yes, sir.
So are you planning to keep it that way? Are you planning to hire somebody or?
Oh, no, we've hired Nina Barrera. Ms. Barrera is the second daughter of one of Mr. Gould's hires.
Kelly.
I assume.
Kelly Barrera.
Kelly Barrera is a civil deputy over across the street. It's her daughter. And of course, Miss Massey is the daughter of both Masseys that work at the
Correction
jail.
officers.
Yeah, did you hire both of those?
No, I didn't. I hired one.
Okay.
I didn't hire Dave.
What happened to this Miss Coleman lady or whatever that was so?
She went to planning, and she.
No, there was
Wait, what-
you said somebody that worked for an agency.
Yep, Miss Coleman. Yep, we no longer needed her once we found the person we were gonna hire.
Okay.
Further discussion on GO1? Hearing none, all in favor?
Aye.
Opposed? Well, we made it without an opposed on that one. Excellent. Thank you, Mr. Palermo. Is there anything else you wanted to add?
I just think that's pity.
I love it. Sorry, Sue,
Thank you.
jumped around trying to expedite things and I just ended up making you stay longer.
I don't
Sorry.
mind, it was very entertaining.
Yeah, I have that effect on people.
Those names you're not supposed to be talking about. Just saying. I just want to say a couple things we've been doing. First of all, Tom Bunn is so patient and helping us with the Dreams Project, and he's getting a little training himself. So that's moving along. The Dreams is moving along. Fred's been reviewing contracts and putting in subcontractors, so making sure they're all in there and we're all covered. He's doing a great job. We're going to be going to Moravia High School out your way, to do passports for the high schoolers that are going on a trip in the spring. So we're going over there Wednesday night next week to help them all get passported up. And I want to say kudos to our 911 staff. I was driving down Melrose Road and
There's a gentleman who fell right on his face, and I picked him up, and I called 911 and I put him in my car, and they're talking to me the whole time, and it's pretty upsetting, but they were just so good, and I wish Denise was here to hear that, but they did an awesome job, and very patient, very professional. We should be very proud of all of them.
I will pass that on if you want me to.
Yeah, I can't say enough, really, when you need them, they're just like that. And we've been doing, Nancy Assman in our historian's office, she did a couple years ago, she did some research for the Auburn Volunteer Fire Department, and just recently they unveiled a new historic plaque. So that's funny. She was surprised to see it took so long, but that it did happen, that they put a plaque out at the Auburn Fire Department. So that was great. And I think that's about it. A lot of people have been using our historian's office. I think the word's just getting around, and they're doing a great job. So we've been training on Laserfish, and like I said, the Dreams Project is moving along. There's no stopping it. And so it's getting really exciting. So, I want to say one more thing. Kevin Swab, who is probably going to talk soon, our Veterans Director, and I partnered on, I just sent it out today, the scam alert for veterans. There's a company charging veterans for their discharge papers to try to get them certified. So they're making them pay like $60, $80 to file their DD-214 and to get a certified copy of them. So what they do is they ask them for their copy, and then they take all these copies and they go to that county clerk and they get them certified. Well, we would never certify that anyway. It has to be, it isn't even public information. So it's out of Arizona, this company, and we just want to warn all the veterans. We file them for free, and they can also be on the Veterans Return the Favor list that we have, and they can get some special discounts. So we've put that out. There he is right there, the man himself.
No, so the only other thing to add to that is if they lose a copy of their DD-214, which a lot of these scammers are preying on, they can just write to the National Archives and request a copy. It's free, it comes stamped, and then it can be put into the record. So there's no need for anyone to pay to get their service records if they are available. That's the hook, is sometimes, they've been lost somewhere.
Avery, yours are sealed.
That's all I have.
Okay, there are lots of questions. Chairman goes first.
Thanks, Mr. Chairman. I just want to say thanks to Sue and thank Mike for keeping us updated on that Dreams project.
Yeah.
That really, it comes in handy.
He gives you almost more than you ever know your whole life.
But it's nice to read. Tell him thank you, will you please?
Yeah, I couldn't do without him, and Tom too.
Thank you. Thank you, Mr. Chairman.
All right, Legislator Shea.
Yes, thank you. Sue, how are we doing with the schedule on the Dreams? We still on schedule, or we?
Oh, we're on schedule. Yes, we are. Yeah.
Still looking good?
It's like any other project that involves the government. And I said the New York State Education Department will go, they put the brakes on everything. Oh, wait a minute, you gotta have this, you gotta have that. So we're getting through it. It's just step by step.
We are the government.
Yeah, we are the government, but we're not as bad. We want to move it ahead. But and I said, all the government layers, I think the county is the best because we can have meetings like this quick. But I'll tell you, they just have so many requirements. It's just crazy.
Try to get a permit.
They're not going to get in our way.
Did you have a question too? I thought I saw something on the call. Yeah.
This is a fun question. I wondered where the kids from Arabia are going.
They're going to Costa Rica.
And passports, can you walk in now or appointment required?
Appointment is required for a new passport or a child who can't renew yet. But if you renew, we get tons of people walk in to renew, get a photo, we kind of look over their thing, they go to the post office. So we haven't had any problem with people waiting a long time to get an appointment or anything. And if our appointments are full, people walk in, we take them. Yeah.
I'll be walking in.
Okay.
I'm a witness to that.
I just thought of something. When kids turn 18, do they need a new passport?
No, really, it's the 16-year-olds where you start to have the 10-year passport. But if you have a passport that's valid it's valid until that expiration date.
Okay.
So if you turn 16 and you don't, your passport isn't gonna expire for a couple of years, you can wait till you're 18. to Go and get the other passport, the next 10-year passport. But you can't renew until you are at least 16 when you apply for a passport. It's a little tricky, but if your passport isn't expired, you don't have to renew it yet.
All right, thanks.
Getting very busy again. I'm gonna say the May 2023 date where people need different documents to fly within the United States. That's all coming into play here. But so far, we haven't had a big backlog of people waiting for a passport appointment. It will happen. It hasn't happened yet.
Okay, further questions for the clerk?
Thank you, Sue.
Thanks, Sue.
Yep.
Appreciate it. Have a good night. Tom, you're up.
Yes. Good evening. You have my report. I just wanted to provide some new information and then just an update on Firstnet if I could. Some good news. The county was awarded a $50,000 cybersecurity grant that I applied for months back. So that's going to allow me to implement some much needed services and applications to even strengthen our cybersecurity posture. Along those lines, I've been working with the State Board of Elections and was approved. We're actually the first county in New York State to gain approval to do a full-blown cybersecurity risk assessment for Cayuga County. So that's going to actually save us approximately $20,000 to $30,000. We're going to get that free of charge from the state.
Awesome.
Yeah. Thank you. So that's going to allow us to prioritize kind of our goals and then use this 50,000 and some other funding as well to kind of attack those priorities. So I want to bring that to your attention. So just to build on one item in my report, it's our migration to Firstnet. And Amanda, I don't know if you had that PowerPoint, if you could just bring up slide 2 on that for me.
She's still on? Yeah, there she is.
So basically, what Firstnet is, it's a cellular service provided by AT&T. And what we're looking to do as a county is to move from our current provider, which is Verizon, to AT&T FirstNet. And basically what Firstnet is, it's a high-speed nationwide wireless broadband network. And it's dedicated specifically to public safety and government entities. So what that's going to do for us is that's going to give us broader coverage, prioritized bandwidth, and just overall better customer service. So in terms of broader coverage, it's still going to take advantage of all the existing cell towers that we have in the county, but AT&T utilizes a different radio for this service. So it actually expands out the coverage a bit better than a Verizon or T-Mobile, for example. Prioritize bandwidth. So this is one of the real big positives to moving to FirstNet. So if I give an example of the fireworks, where we have mass gatherings and stuff like that. When everyone's trying to get on their cell phone at the same time to make a phone call or a text message, you can get throttled down. You can lose connectivity. But what FirstNet does is it prioritizes your phone over everybody else, being a first responder or being in this program. So you will have that connectivity and bandwidth as you need. So in the event of an emergency or like I said, a big social gathering, you'll maintain connectivity throughout. So that's great. Customer service. I've been working with FirstNet over the last 3 months. Actually, the sheriff brought this to my attention, and I've had several conversations with FirstNet over, like I said, over the past few months. It's been a very positive experience. Their customer service has been amazing. They got us set up with our portal right away. We had trial devices, which we tested in our patrol vehicles with the sheriff's department, with our own IT department over the past 3 months. So we've proven that it's going to work, and it works well. In terms of the purchasing of FirstNet, it's all on New York State contract, OGS contract. There's no official contract that the county needs to sign, so we can literally cancel the service at any time if it doesn't work. But like I said, we've done significant testing, and I'm very confident it's going to work out well for us. It's also going to provide significant discounts. We're going to, the actual cost per line is $2 a month cheaper than Verizon. So we're going to see some initial monthly cost savings there. And then we're also going to be able to sell our existing Verizon equipment, our MiFi units, our iPhones back to Firstnet and receive discounts on those as well. So we're actually going to go several months without having a cell phone bill for the county if we go this route. So as I said, we're going to trial this with the sheriff's department and our IT department. Have it in place for, a few months, make sure it's the solution for us, but then we're going to roll that out countywide. That's the goal here. So if there's any questions at all on Firstnet and the migration process, I'd be happy to answer, but we're ready to go with this project.
Just a question about that with the cell phones, and will we be changing over those devices then?
Yep.
And will there be, you said we're gonna go a couple months without a cell phone bill, I assume?
Yeah.
That we're not going a couple months without cell phone.
Correct. Oh, no. It'd be an instant migration. We wouldn't, we'd be essentially, you come in, we transfer your data and hand you back your device.
Okay.
It's a pretty seamless process, and we have it down pat already with what we do with Verizon. We just got to transfer that to AT&T, but we have the process down, and like I said, I'm very confident that the VS service is going to be great for us. So.
Yes, sir.
Is there any coverage areas that it does not work?
So does not work in that we currently have where we don't have service, we might have better service now. There's still some like rural areas in the north and the south. Yeah. But for Verizon, we don't have coverage in those locations currently as we sit today. So in my experience working with the sheriff's department, when we put folks up there, they reported a bit better coverage. I don't want to promise that it's 100%, but I think it's overall better overall coverage than Verizon.
Thank you.
Yeah.
Mr. Chair.
Yeah, Tom, could you explain to everybody about Tetra Tech and the safety committee?
Yeah.
What's going on with that?
Yeah. So just in terms of that project, we've been working with the sheriff on those sort of plans. And as far as our IT department goes, we're kind of working hand in hand on looking at an application that will kind of help with mass communication to our citizens, to our own staff. I'm sorry, Chairman, I just can't recall the name of the.
Tetra Tech?
Tetra Tech, yeah. Tetra Tech is going to help us guide us through the process and kind of walk us through what that looks like.
That's okay.
I'm sorry.
No, that's good enough.
I can come back with more information on that, but
I just wanted them to know a little bit about the safety committee and Tetra Tech.
Yeah. But again, from the IT perspective, we are looking at an application to kind of help develop a threat assessment product so that, our internal folks are notified. It also gives our citizens the ability to basically utilize a mobile application to call in a threat. So, you could potentially leverage your mobile device, quickly type up an anonymous note to kind of tip off our internal group, or it would have direct connection with our 911 center. That's about the extent that we've gotten as far as conversations with that application, but it's very promising. It looks great.
Thank you, Tom.
I'll take a motion for GO7 at this point. Oh, I won't. We'll stand by on GO7.
I just want to give kudos to Tom and his staff because he's got an awesome staff. And I usually visit him when passwords are due,
Yeah.
to unlock it. But
which is coming up.
Well, no, I just did it, but they always take care of the problem. They're always buzzing around and working hard, and we see them throughout the county buildings and even outbuildings. They're just incredible, and I have so much confidence in them. And I wanted Tom to know that I do appreciate all that they do, and they're a great staff. Thank you.
I think Bobby can speak for all of us. That's doing a great job.
Absolutely.
I
second
Mr. Petra, you still good with moving GO7?
Go.
Can I get a second on GO7?
Second.
Outstanding. Thanks for showing up.
Hey.
Did you want to discuss?
Yes, absolutely. So basically what this resolution calls for is we're going to enter into a shared services agreement with New York State So back in February 2022, the governor announced that the state will be offering a cybersecurity shared service. So what they actually did is they took several months to build out what's called a Joint Security Operations Center in Brooklyn, New York. And that's kind of a brick and mortar building where they are building a lot of secure infrastructure that will ultimately support any municipality, but obviously counties as well. So by entering into this agreement, what this calls for first, the first step in this agreement is them offering what's called an EDR software solution. And that is going to get us a set of tools that is going to monitor our workstations, our computers, and our network to determine if there's any malicious activities going on that we should be aware of. Of course, we have an EDR solution right now, but we're paying out of pocket for that. And that's about $10,000 that we're now going to free up because we're going to be hopefully taking advantage of this shared service. So it picks up any, and again, I should talk just briefly about the software itself. It's called CrowdStrike, and they are basically the industry leader. And the cost of that platform is something that we can never traditionally afford as a county. So I'm very, very excited to hopefully get started utilizing that platform. The other benefit to that as well is now we're going to have a whole secondary set of hands at this operations center because they will be notified of any of these alerts as well. So we are kind of going to be working hand in hand on not only identifying ransomware as it relates to Cayuga County, but as it relates to the state, as it relates to the United States. And they have, resources like the FBI, CISA at their fingertips. So we are all going to operate as a collaborative and ensure that, we can stay ahead of the game in ransomware and, kind of lead those efforts. That's why this shared service is just so critical. So.
Further discussion on GO7?
Can I just ask one question?
Absolutely.
Or maybe it's a comment, but it seems like.
Oh, wait, a comment? Sorry.
It seems like a very forward-thinking initiative coming out of the state. And I was just curious, is it open up to all the counties now? Is it open up to all the towns, villages, cities?
It's open up to counties right now.
Okay.
They're going to be expanding that as far as I know. I'm actually headed to a conference tomorrow, our director's conference, where they're going to have more information on this. But yeah, they literally built up the Joint Operations Center, hired hundreds of people within the last 6 months. So it's rocking and rolling. And I know it's going to be expanding in the next 12 months. Yep.
Great.
Further discussion on GO7? Hearing none, all in favor?
Aye.
Opposed? Carried. Any further questions for Mr. Budd?
I just had one on your report, if that's okay. The countywide network infrastructure project, you said once it's complete, it'll provide reliable, scalable, redundant network infrastructure. What did we start with? I'm just curious.
Yeah, so it's actually funny. I did a PowerPoint back in like October last year, where I kind of went over the state of infrastructure and like the 4 pinpoints that we had to attack. And our network infrastructure was like number 1 on the list. But essentially we're coming from, one main point of failure. I mean, we have a lot of money built into the infrastructure, but there's no redundancy in the infrastructure. And also the configuration of the network, the way it was designed, and then the way it was maintained over the years was not done to spec, and I'll leave it at that. But there's a lot of work where we basically picked everything apart and started from ground zero, and now we're rebuilding the configuration. We're going to load that onto the new hardware, which we are in the process of doing right now, and then we're going to get basically cut over a department at a time to this new network, and so much nicer. Just from a support standpoint from IT, and just, everyone's going to experience just such a better network experience while you're here. So, yep, it's a work in progress, but we're making good progress.
Any further questions? Thank you, sir. Of course. Appreciate it.
Thanks, Tom.
Thanks, Tom.
I think just Mr. Swab with Veterans is next. And last but not least.
All right, I've got my report for consideration. We've got our new part-time veteran service officer, working on getting him accredited as soon as possible. One thing is the New York State Farmers Market coupons are gone. We had over 1,000 of those, and we distributed them to veterans in our office and at different events. So that's the first year we've done that. It was been well received. I think next year, I'm learning, I'll be better next year. And we might even be able to give away 2,000 or more, I believe. We've had that many interactions. Working on communicating with veteran service organizations about the green light for veterans and the information sessions on Veterans Day with the YMCA. Those are the key updates that I have. Pending your questions.
Any questions? So you don't have any resolutions, so it would just be questions for the director? Looks like you get off easy tonight. Thank you.
I do not. Next month, I probably will. I heard a lot of talk about peer mentorship, and I heard the doctor talking about that, and that's what the heart of the Dwyer program is. So I'll be bringing a resolution for some veteran service officers to be peer mentors next month.
Okay, look forward to that, sir.
Can I ask a quick question?
Go. Okay, one question, Kevin.
Kevin, I just want to know how many inquiries you have on the Camp Lejeune water. Is that something that affects us at a large number, or?
No, we don't keep track of that individually. I mean, we can look into our records and get that, but it's actually kind of trailed off. But when it first came out and all the ads, you've seen the ads for Camp Lejeune. The word is getting out to the veterans that these lawsuits could actually be detrimental to veterans, because if you win the lawsuit and you have a disability claim with the government stops the disability claim until the amount that was given out in the lawsuit is paid back. So the word is getting out there. I'll probably take this bullet off next month, but we still get a few calls about it. But what we're actually getting are more veterans coming in for disability claims now that there's more presumptive Agent Orange locations, presumptive conditions for the Camp Lejeune. So we are getting more veterans coming in for disability claims from that.
Didn't know that bullet point. Thank you.
Any further questions? All right, thank you, Kevin.
Thanks, Kevin.
Okay, so just wanted to bring up this. In the past, we had not voted on legislature resolutions, but just for everyone's notice, fixing the day notice of public hearing on a local law to authorize video conferencing for public meetings. That'll be brought up at the legislature. So unless anyone has any further comments, questions, or concerns, I will entertain a motion.
Second.
Did you need something, Chris?
I just wanted to point out that the resolution, it says LEG at the top, that should say COA. I'd like to make that amendment.
So
friendly amendment.
Ledge 1 is CLA 1?
COA. All local law we've been referencing is the county attorney's office, so they're easy to find and categorize.
Okay, so Ledge 1
It just changes the number.
is now becoming COA 1. Okay.
Is that all right, Amanda?
COA or CAO, county attorney?
COA.
Yep, got it. We're just making this a friendly amendment, right? We don't need any motions on this.
I don't think so. It's your numbering, so.
Yeah.
I didn't know there was such thing as friendly amendments.
Yeah. All right.
We
So,
like them.
barring any further friendly amendments from those in the north, I'll entertain I think Mr. Petcher, and it was second by Mr. Shea. So I will hear no discussion about it, and you are all in favor of it. So have a good night.
Thank you, everyone.
What a night.
Thanks. Wow. Dang, 2 hours. That's why we said, I was like, it's gonna be fast.
You jinxed us.
Never said it.
See you later, Jen.
Obviously, you see, obviously you didn't pay attention last night.